Self-Management Week. Embedding Supported Self Management at the heart of Scotland's biggest health charity. Joanne Graham, Director of Service Delivery, Chest, Heart and Stroke Scotland. Follow us on X at Self-Management Scot and Alliance Scot. Health and Social Care Alliance Scotland.
Firstly, good afternoon, everyone, and thank you all very much for joining us today and taking time out of very busy schedules, which I know that you all have this week. So today, I suppose what I wanted to firstly do is just do some introductions. I won't go through everybody and ask you to do introductions, but for those of us who are presenting today, we'll introduce ourselves, and then I'll tell you a bit more about what this session will entail. So firstly, I am Joanne Graham, Director of Service Delivery with Chest, Heart and Stroke Scotland. And I'd also like to introduce just two of my colleagues at the moment. So Lindsay Duncan is also on the screen. Lindsay will be joining me after the first 15 minutes to support in the session, just telling us a bit more around how we've embedded self-management and CHSS. And then Paula Leask is also with us. Paula is our self-management facilitator at CHSS, so she will also talk to you a bit about her experiences of some of the transformational change that has taken place in the organisation. So we're delighted to be here on what is Self-Management Week, and it's been a busy week, I think, for us all, and indeed Craig and I, along with our CEO, attended the Alliance Self-Management Award ceremonies last night. So I don't know if any of you were there, but it was a fantastic evening. And firstly, I would just like to say a huge congratulations to all the winners, and indeed all of those who were shortlisted for the awards last night. And I think for me, really what the event reminded me of was the great work and the incredible projects that are going on out there in terms of self-management, but really how collaboration and I suppose partnerships and that sharing of ideas is really critical in enabling us all to be able to support people either with long-term conditions or indeed anyone to be able to self-manage in their everyday lives. So today, the aim of our presentation just over the next hour is to discuss how Chest, Heart and Stroke Scotland is embedding supported self-management at the heart of our No Life Half Lived 23 to 28 strategy and what that means for service delivery. You will hear a bit more about how we've developed our supported self-management and community recovery model, which encompasses all of our service provision, and that's underpinned by the principles and ethos of supported self-management. We'll also then discuss how the voice of lived experience was at the core of that strategic ambition, so I'll talk to you a bit more about that, along with how we've introduced a new 6-week evidence-based supported self-management programme, which was originally developed at Stanford University. So Lindsay will go into a bit more detail about some of that work. We'll also hold some breakout rooms partway through the session, and we'll keep each section of this session relatively short and snappy. And then towards the end of the session, we'll hear from Paula Leask, who I've said is our new supported self-management facilitator, and Paula will talk to you a bit more about her experiences of the cultural change and what's taken place in service delivery and what that's meant for her, I suppose, as a member of staff delivering services. So for the first part of this session, however, I will give you more information on self-management, how it fits into CHSS's strategy, and how we've started to go about what has become quite transformational for us as an organisation and incorporating supported self-management across everything we do. So for those of you who maybe don't know Chest, Heart and Stroke Scotland overly well, we as an organisation have been supporting individuals in Scotland for over 100 years. And key to the longevity of the organisation has really been our ability to adapt and evolve when needed. Prior to the COVID-19 pandemic, we supported individuals with chest, heart and stroke conditions. And at that point in 2018, we launched our No Life Half Lived strategy with the main aim and mission to support those with our conditions to live their lives to the fullest. During the pandemic, however, and partway through that strategy, CHSS adapted to include long COVID as one of our supported conditions. And then last October, we adapted again with the launch of the refreshed No Life Half Lived strategy. So No Life Half Lived was launched originally in 2018, but then we've done a refresh. So part 2 of No Life Half Lived was launched last year. And this was really in direct response to the increasing pressures that we saw in the NHS And the concerning trends in healthcare outcomes that we have started to witness and see across the country. And this refresh strategy for us firmly positions supported self-management at the heart of really everything that we do and all of the services that we provide. And it sets out the challenging target to reach 175,000 people annually by 2028. But why did we feel the need to embed supported self-management and community recovery at the core of what we do? And why is there actually such a huge need for us as an organisation in Scotland? Well, I think the stats here on your screen, which you'll all see, tell us exactly why. So we know that there is around 180,000 people living with long COVID in Scotland. We also know that there are around 136,000 people living with the impact of stroke in Scotland, and there's around 300,000 individuals living with coronary heart disease. And we also know that those individuals are not just suffering from one condition, but many have multiple comorbidities, and that makes lives and living their life with those conditions more complex than ever. And ultimately, that tallies up to 1 in 5 people in Scotland, 1 million people living with one or more of our conditions. The classic but historic biomedical model that's always been used in healthcare previously will not support those individuals fully. And for individuals to truly live their lives to the fullest, a biopsychosocial model is more definitely needed. And that's really where we start to focus on the whole person and not trying to see them through the lens of their condition or through the lens of their symptoms, but actually really trying to understand the whole person and what they need rather than focusing in on the condition solely. Now, running in parallel to all of that need is obviously the health and social care system in terms of pressure and the sustained pressure that's under at the moment, and that only seems to be increasing. And it's evolving as well, I think, as time goes on, with more individuals requiring support from that health and social care sector. An ageing population is clearly adding to those pressures, and the financial health of the health and social care system is arguably in one of its worst positions possible, with services and systems really starting to creak under the weight of that pressure. Now, of course, as an organisation who has campaigning at the heart of what we do, we can shout about those issues and we can challenge that as an organisation. But actually what we've tried to do is turn it into a positive and look to see where an organisation such as us, who also has service delivery at its core, we wanted to see, and we felt it was important to act and adapt our strategic vision to ensure that what we deliver is to support the system rather than solely critiquing it, and look to see how we can deliver services in an attempt to release pressure on the NHS. So we developed our No Life Half Lived model, which is delivered by our community healthcare support services teams. And I'll go into a bit more detail about that model in the next couple of slides. But before I start to talk to you a bit more about how we embedded self-management at the core of what we do, I just want to remind everyone what self-management actually means. And there's so many definitions and there's so many different ways of people describing what supported self-management or self-management is for them. And I think it really is an individual thing. However, I thought this quote from the Alliance, which I picked up, was quite a nice one, particularly for us when we're trying to talk to you guys today a bit more about how we've embedded this as an organisational approach. And it picks out the key themes and demonstrates that this is not about developing a service and voila, we as an organisation are now delivering supported self-management. It's never as easy as that. But rather it's about a way of working for us and it's about a way for those who are actually suffering from long-term conditions to have more control over their condition and considered to be an expert in their condition and having more control over the services that support them and the decisions based on what they require. For us to embed that approach, however, in our organisation did require a whole system approach and effectively transformational change to how we worked, the services that we delivered, the systems and the processes that we had in place. We needed to change all of that to really ensure that our services were aligned with the principles and ethos of supported self-management. So what is a whole system approach? Well, essentially it's about working with communities and individuals to identify what we thought that the problem was, then identifying a solution and incrementally then testing that solution in collaboration with partners to ensure that we can continue to refine and ensure it meets people's needs as time moves on. And ultimately what we're aiming for is that for that challenge or problem to be solved. And again, as I've mentioned, you cannot fix just one thing or add one service, but all aspects need to be adjusted across an organisation to accommodate the principles and ethos of self-management. We cannot add just a singular new service, such as our 6-week supported self-management workshop, into our pathway and think that we now support people to self-manage. We cannot keep our systems set up where service users fit into our needs by us controlling what the services or what we think the services are that they require. And we cannot continue to have service delivery teams deciding on what service users should have rather than supporting service users to start to take those decisions with us. We need to adjust a whole system and Sage says, and a whole way of working. So we needed to identify the challenge, identify the solution, and then test that over time. So how did we identify that? Well, prior to the launch of our strategy, we engaged with over 1,800 individuals living with our conditions in what we call our 1 in 5 report. And if you want more detail on that, you can just go onto our website. It's on the landing page, almost the 1 in 5 report, so you'll be able to download a PDF of that. And that report was really to better understand what people wanted from us as an organisation, understand the challenges that they were facing every day, and what did they want from the wider health and social care system. And it was evident from that report that people living with our conditions are not getting the rehabilitation and support to self-manage their condition. That's what they were telling us. We also engaged with stakeholders from across Scotland through an external company to hear what they thought about us as an organisation and what they wanted from national third sector organisations. And all of that engagement work gave us the answers. They told us that they wanted community services to support them in their lives in a way that was meaningful for them and have a range of service provision and options available, crucially at a time that suited them. So not to fit in with the standard 9 to 5 working hours. Those within the NHS and social care told us that they needed us to own the community space in an effort to release pressure on the NHS and to support people at home. And that was really in an effort to prevent readmission rates. They also told us that they required access to supported self-management services across all their conditions that are not available in just one area, so not that postcode lottery, but they wanted the same availability across the country. And they also told us that they required access to an evidence-based, formalised self-management workshop where outcomes for patients were clear and defined. So that was a challenge. And then we had to work on, well, that's quite big. So what is the potential solution to all of this? And we believe the solution is the No Life Have Lived module, which you can see on the screen now. And that's delivered by what we will call, and hopefully you'll have heard of, if not already, you'll hear it in the future, Community Healthcare Support Service. So this is a quality supported self-management and community recovery model, which is informed by expertise, but most importantly, the experts are the people themselves and their conditions. It's informed by them. Our model incorporates all of our service provision, and each service available will be underpinned by the principles and ethos of self-management. Those services can be accessed at any time, from pre-event through to acute health event or diagnosis of long-term condition, and then throughout recovery and onto long-term management. Individuals can move between phases as needed, and crucially, volunteers and peer support contribute to all phases of that pathway. So this is not about staff delivering each individual service. This is around peer support and volunteers being a core and central aspect to each and individual service throughout the whole of that pathway. Our plan is to incrementally test the pathway in NHS boards and then evaluate the outcomes and impact for service users, but also for the NHS boards where we deliver it. And then, of course, we'll adjust and adapt parts of the pathway as we go along over the next 4 years. Ultimately, our aim is to roll this model out into every NHS board by 2028. So this diagram allows you to see what the stepped pathway can look like in a bit more detail. As I've said, it's a pathway where people can come in and out as needed. This does look linear, but it's really just to give you a better understanding of the types of services that we have. So the model includes a range of those services from clinical support services, structured and formalised supported self-management workshops, one-to-one community support, health information, peer support and more, which are available to everyone with our conditions. Each